Thank you very much, Mr. Toastmaster. This is a mythical opportunity for me to tell a parable about this marvelous program that I got myself into. So I'm going to tell you three things today. First, the why, who, and what of physician assistants, to give you a little background. And then I'm going to tell you a little bit about the CSUMB journey and what that's been like. And third, the joy of working with a dozen of our faculty and all of the marvelous preceptors I've met in the Tri-County area. So the who, what, and why of physician assistants in the 60s, which some of you have read about, some of you have lived, there was the passage of Medicare and Medicaid in 1966, which opened up the gates to insurance for older people and people without means, but there were not enough physicians or nurses or other people to take care of all these new people. Some very innovative educators came up with the idea of using other people to work with physicians to do what physicians normally did. And since at that time there were 6,000 military corpsmen coming out of Vietnam every year, 1,600 of whom had independent duty training, and they were very skilled, but there was no civilian job for them. These innovators came up with the idea of taking their skills, building on them, and creating what became physician assistants. So that's how the idea got started. We've now gone from these early programs to 275 accredited PA programs with 140,000 graduates. And they are practicing medicine under and with physician supervision all around the country, doing work in primary care, underserved areas, surgery, lots of different disciplines. And it was my pleasure to be part of one of the early programs, starting a program in 1970 at Yale Medical School, which is about the fourth program. But nothing prepared me for the second topic of my talk, which is starting a new program locally at CSUMB, because of the 23 CSUs, no other place had considered having a physician assistant program. And the provost here said, let's do that. This required a lot of bureaucratic work. It required setting up a whole new college of health sciences and human services. It required working the financial side at the extended ed part of the university and the academic side at the CSUMB part. All of this makes every day-to-day activity mythological. It's really remarkable. But what was fun was to meet with new faculty that we recruited from Stanford and CSUMB and elsewhere to work in new space out in North Salinas, and then deal with something that I couldn't possibly have researched, and that is a pandemic, because the last time we had a big pandemic in 1918, there weren't no PA programs. So I couldn't do any research on how do you do PA education in the middle of a pandemic. Because basically we learned as we went. We had to close down for our first class that's going to graduate in a month of 29 students. We had to close down for 4 months last year their clinical sites and clinical rotations, which meant we had to scurry around because this is a master's level program, 27 months. What are we going to do with the students during this period? So we moved the semester that we're now in up to the summer. They had to give their capstone speech then, and we shortened the rotations and did a lot of transitioning, as we've done at Toastmasters, into Zoom. And one of my goals for this group of students was to teach them presentation skills, because that's something that's left out of all of our education community. That's part of why we all joined Toastmasters. So I had them come in groups of 2 and 3 to my other Toastmasters program, which was oratoriados on Monday night, and actually sit in. And then I had 2 of my Toastmaster buddies, Christian Crump and Megan Mayer, join me in giving a 3-hour presentation to each of the first two classes and then make them by surprise. They didn't expect this, but they had to give an icebreaker speech in 1 minute, which they all got through without having a heart attack and then wished they'd done it sooner. So I love to be able to translate my Toastmaster skills to that. The third point is the joy I've had in working with the faculty. I've learned from one of our doctor colleagues who was at Stanford about a spiral curriculum where she every semester takes the same issues, but takes them to a more advanced level. Fascinating. I learned from one of our other colleagues who's both a nurse and a PA and very involved in the military about setting up the tent at Joby as an overflow possibility in case the hospitals didn't have enough room. Turned out we haven't needed it, but he got a lot of play in the community as he deserved for his organizational skills. Met a lot of old friends because I've been here now 38 years on the peninsula, so I could tap on the shoulder of an old surgical friend, an old psychiatric friend and say, hey, could you be a preceptor? Since we're not paying any of these folks, they are, whether they're physicians, PAs, nurse practitioners, they are all doing this voluntarily. And then met by going South County to Me Memorial and North County to San Benito, a whole new group of doctors and people that I didn't know and in these areas, in rural areas, doing marvelous things for the rural community, for the underserved, primarily Hispanic people. So it's been a great joy to be part of this, and I can't wait to see 29 new PAs graduate after 27 months. They've been real troopers throughout this whole thing of dealing with all the changes back and forth with the curriculum, and wishing them well. Hopefully a number of them will practice in this Tri-County area, but some are going back home to Hawaii or Texas or wherever they came from. Mr. Toastmaster.